Thank you all so much for joining today. I'm really excited to have so many folks joining us. It's going to be, we hope, a great session together. This is Open's Take 60. Our title is, let me get to my next slide. Is Medicaid adult dental benefits are not optional. Oral health is health. My name is Stacy Auger. I am a policy consultant here at CareQuest Institute, and I am really so thrilled that you can all be here today. We have a really, I think, nice agenda that we're going to walk through. Great presenters, great speakers, and I, again, thank you all so much for being here. So let me tell you, actually, let me first just go through some housekeeping items. Sorry, my fingers are moving faster than they should be. Just a few housekeeping items before we get started. As with all of our webinars, we are recording today's meeting, and we'll be sharing the slides and the recording after the event today. We've muted all your lines upon entry, and you'll be able to adjust that as needed later on. We are going to be doing a Q&A session at the end of our time together today, but throughout the presentations, please feel free to use the Q&A box. It's located on the bottom of your screen, and pop in any questions that you have along the way. We'll be keeping track of those, and we'll get to them towards the end. And if you're comfortable doing so, please adjust your Zoom name up with your picture and include your pronouns if you're comfortable and your organizational affiliation. So we're going to dive into it. Let me tell you what we're up to today. Try to go. Hopefully I didn't go too far. So we're going to be talking about Medicaid adult dental coverage. I'm going to give you an overview of kind of what the status is with benefits and kind of what the landscape is right now. And then we're going to hear from Caroline Lee, my colleague here at CareQuest Institute. She's going to walk us through some updates from the federal level and explain to us some of the current challenges and threats that we're facing at the moment. And we have a really wonderful panel with our friends and colleagues from Utah. We have Dr. Jennifer Strohecker, who's the Medicaid Director at the Utah Department of Health and Human Services, and Dr. James Becker, who's the University of Utah School of Dentistry. They are going to talk to us about the incredible journey that they've had in bringing Medicaid adult dental benefits to their state and share some lessons learned and things we can all try to emulate across our states. So let's move into it. Let's get started. I'm sorry, my slides are moving a little bit slowly and hopefully not jumping too far. But I want to just get into what we know about coverage. We know that oral health matters, and we know that coverage matters. What I'm about to say is certainly not a shock, I think, to anyone on this call. Oral health is vitally important to us. And then we know that when folks do not have good oral health, when they are in poor oral health, they are really at risk of some severe health problems. We know that oral health is closely related and connected to a host, poor oral health is connected to a host of health problems, things from higher risks of heart disease, stroke, and diabetes, complications with pregnancy and childbirth, adverse mental health outcomes. And we also know that our oral health is closely linked with our employability, with our individual or family financial security, and with our ability to interact with others in our lives and in our communities. And so just like oral health matters, coverage matters, dental coverage matters. And what we've seen from years of research and experience is that people do better when they have coverage. They have greater access to and utilization of regular dental care than they would if they did not have coverage. Folks are less likely to seek care in emergency rooms because they have regular sources of care to take care of problems before they get too big. Folks are more likely to enter or remain in the workforce. And for adults with children, those children benefit too when their parents have coverage. We know that kids whose parents have coverage are also more likely to receive timely and appropriate dental care. So this all is very, very important. So where do Medicaid benefits fit into all of this? If benefits are so important, what are we looking at for Medicaid? So the picture is quite different. Oh my goodness, I'm so sorry. My slides keep bouncing. The state of Medicaid dental coverage is a little bit tricky. It is very different for children and adults. For children, we're very fortunate that dental benefits are a mandatory benefit for children under EPSDT. This is not the same, or the same is not true for adults. So for adult coverage, dental benefits are considered optional by the Centers for Medicare and Medicaid Services, or CMS. There are a number of services within Medicaid that are considered optional. Things like eyeglasses, prescriptions, physical therapy, and there's a long list. But for dental benefits, they are an optional service, and this gives states a lot of wiggle room on what they can do. So for instance, as an optional services, states can decide that they want to limit the number of services or the types of services that they cover. I could say, we're going to cover, for instance, cleanings. We're not going to cover periodontal services, just an example. They can decide whether they'll cover all adults or whether they'll cover certain groups of adult members, whether that be, for instance, pregnant folks within their postpartum period, and folks with IDD. They can make that decision whether it's some or all. And then they can also exclude dental services entirely. And so because these services are optional, there is this very wide variation of benefit levels across the states. Sounds bad, but in reality, we're making really great progress. So let me show you kind of where we are right now. So there, as I said, has been really, really tremendous growth over the last several years. In the late 90s, early 2000s, we saw a lot of states that made cuts to their benefits due to, recession, different changes happening at the state level. Between 2020 and 2024, we actually saw this enormous growth in benefits, whether they were restorations of services that had previously been cut or reduced, or new services entirely. And so during that 4-year time, we actually saw that 28 states expanded their benefits by one or more services. Again, things like cleanings, perio, dentures, things like that. Or if they increased the frequency by which they were covering services, so covering cleaning going from once a year, maybe twice a year, 3-4 times a year. We saw that 13 states either increased their annual benefit maximum, which is the amount that beneficiaries can spend for the year, or eliminated it entirely, which is great to see. And we know that 11 states and the District of Columbia now offer an extensive Medicaid adult dental benefit to all their adult beneficiaries. So I want to come back to this 28 state number. And so we did have in this time period 28 states that, like I said, either expanded their benefit by one or more service or increase the frequency. Of those 28 states, we saw 12 states that are listed here that had really enormous expansion of their benefits, which is so exciting. So these states all went from a very small, limited, or emergency-only benefit to quite robust programs. You'll see the years that they did that, years that they've made these improvements over time. And I do just want to point out one category of state that is not listed here are states that made changes. These were all states that made changes for all their adult beneficiaries. There are several states, Alabama, Louisiana, and Utah, which you're going to hear about in a little bit, that made incremental changes over these time and started offering a more robust package of benefits to certain groups of adults. So folks with IDD, pregnant postpartum adults, things like that. So those are not listed here, but I did want to share this because this is really, really tremendous growth. So how do we know this? How do we know what has happened? Well, I didn't just come up with these numbers on my own. So these are numbers that we found using two tools that CareQuest and our wonderful partners across the spectrum have helped us create. So you'll see here we've worked with the American Dental Association's Health Policy Institute, the Center for Healthcare Strategies, and then a wide-ranging advisory committee made up of experts of oral health and state health policy folks. We used, over the course of several years, developed two, we think, really great tools that we hope you know about. If you don't, you'll hear about them today. The first, they're long names, the Rubric for Assessing Extensiveness of State Medicaid Adult Dental Benefits, or Rubric for short, and then the Medicaid Adult Dental Coverage Checker, or Coverage Checker. So the Rubric is a survey tool that we developed with our partners that defines an extensive Medicaid adult dental benefit and that assesses the extensiveness of coverage within each state. The coverage checker then takes the results of the rubric surveys and puts them into an online dashboard so that you can see how things have shaken out across an individual state in comparison to others, things like that. We have done this survey 4 times in 2020, 2022, 2023, and 2024. We should have a new survey coming out in 2025, so keep your eyes open. And let me just tell you a little bit more about both of these really quickly. So as I mentioned, we have this rubric, which is a survey tool. It defines an extensive Medicaid adult dental benefit. You'll see this definition here. And then it lays out the criteria that states need to meet in order to hit this definition. So where this came from very quickly was that, as many of you know, previous definitions that have been out there were a little bit lacking. They looked largely at the number of codes, total number of codes that were covered by a state, and whether or not the state offered and had an annual benefit maximum. Our group really wanted to go deeper. They really wanted to better understand what was happening out in across the country and really come up with something that brought us into, closer focus on where things were. So in developing our definition and our tool, we decided that we wanted, when we defined our adult extensive benefit, to say we want to say these are the service categories that are necessary, that are needed to be covered within this definition. These are the specific procedures within each service category that you need to cover to meet this definition. And then these are the frequencies that you need to be providing these services at. So you'll see our list of survey measures or questions that are in the survey. This is a 14-question survey. And in order to meet the definition of an extensive Medicaid adult dental benefit, states need to provide coverage within each of the different measures. They need to have either no annual benefit maximum or a benefit maximum of $1,000 or greater, and then provide coverage to all adults. So what we do then, as I mentioned with the survey data, is take it from each year of survey and put it into the Medicaid Adult Dental Coverage Checker. This is an online tool. This lives on the CareQuest Institute website. And if you were to come on there today, which I hope you'll go visit afterwards if you haven't already seen this, this is the screen that you'll see when you first come in. The coverage checker has 3 main sections to it. You'll see they each have a tab at the top. And let me just walk you through these different sections before I move on. But so the first section that you'll see there's 2 parts to it. The top is a map of the United States, and if you hover over, you can actually see how every state has done on each of the survey questions or measure. You can then move to the bottom section, which is the rainbow color, and this is a continuum that allows you to see where states fall on a continuum of no benefits up to an extensive benefit. You can again hover across each state to see how they did on each survey measure. The second tab looks at time trends. So one of the great things we are now able to do with 4 years of data is do some comparison. Where were states, how are they doing in 2020? How are they doing now? What were they covering in 2020? What are they covering now? So you can see that within the time trends section. And then the final section looks at just some different benefit or program information that the states have provided in the survey by the different survey question or measure. So these are really, we think, great tools. We're very, very proud of these tools, and they are really meant to be resources for everyone to use to better understand their benefits, to understand where their state is in comparison to others as trends are developing, and really help states identify areas for self-improvement to their benefit. So I happen to love these tools if you haven't caught that already, and I am happy to talk with anyone that would like more information, happy to talk offline. I will point right here to a little tutorial that we've developed about the coverage checker. Every year as we have new years of data, we gain some more functionality. So there are some new features that you can explore in this tutorial. And again, I am very happy to talk about this. Our country and our individual states have made such tremendous progress, and it's incredibly exciting and rewarding to see this. And I want to thank you all for the incredible work that you do. We are certainly in times of challenging times. And I'm going to stop here, catch a breath, and let Caroline walk us through some things that are happening at the federal level. And then I'll be back to introduce our friends from Utah. Thanks, everybody.
Thanks, Stacy. Hi, everyone. My name is Caroline Lee. I am the public policy analyst here at CareQuest Institute for Oral Health. You just advance one more slide. As you all probably know, the One Big Beautiful Bill Act was passed on July 4th, and it includes very deep cuts to Medicaid that will have lasting impacts, particularly on dental coverage. So now, more than ever, it's critical to understand what these cuts mean for oral health care, and I'm going to dive into some of the provisions that are most likely to affect dental coverage. First, eligibility changes and work requirements. Currently, 23 million adults rely on Medicaid for dental coverage. Like Stacy outlined, many states offer adult dental benefits, but these benefits are optional, and they're often the first to be cut when budgets are tight. So OBBBA, or One Big Beautiful Bill, introduces frequent eligibility redeterminations and new work requirements, which are already among the first policies set to take effect. Adults covered through Medicaid expansion will need to report at least 80 hours per month of work, school, or community engagement activities. Reporting must occur at least every 6 months or more, often depending on the state. And by June 2026, the Department of Health and Human Services will issue rules to implement these requirements, and states will have 7 months to design and launch their programs. Some states may delay until January 2029, but only if they demonstrate a good faith effort to then implement their program. Additionally, Medicaid expansion populations will need to redetermine eligibility every 6 months, starting January 1st, 2027. While there are exceptions for children, pregnant people, people with disabilities, and certain hardship cases, history shows that many will still lose coverage due to burdensome verification processes. So we can expect that the result of this is millions of families and individuals losing access to both health and dental coverage. The second major impact is on provider taxes, which are essential for financing state Medicaid programs. The One Big Beautiful Bill Act freezes provider taxes at current levels and phases down the safe harbor limit from 6% to 3.5% by fiscal year 2032. Without flexibility to raise these taxes, states will have fewer dollars to maintain optional benefits, making adult dental coverage particularly vulnerable. So, put in very simple words, there's less revenue for states, meaning there's fewer resources for dental care programs. Stacey also walked through this, but these cuts matter because we've seen history provides clear evidence in states like Oregon, California, Maryland, and Pennsylvania. Eliminating Medicaid adult dental benefits led to increased dental emergency room visits. Emergency visits cost roughly 3 times more than a routine dental visit. In Missouri, California, and Massachusetts, cuts shifted costs to community health centers, straining their capacity and financial stability. In Massachusetts, private practice dentists saw revenue decline because they had previously provided care for many Medicaid adults. Dental care is already expensive. More than 72 million adults in the US lack dental insurance. Without Medicaid coverage, families face dental debt or delayed care until emergencies arise. And coverage isn't just about teeth. We know it supports employment, financial stability, and overall economic security. So overall, Medicaid cuts under the One Big Beautiful Bill Act pose a serious threat to oral health access for millions of Americans. And we're hoping that through education and continued advocacy and proactive engagement, we can mitigate some of these impacts and help families maintain coverage. Thank you all. I'll pass it back to Stacey to get our panel started.
Great. Thank you so much, Caroline. I very much appreciate you sharing that. We are certainly in challenging times, perilous times, and everyone I think on this call has worked so hard over the years to elevate the importance of oral health, to get our communities, our policymakers, a wide range of stakeholders to understand how important oral health is, how important these benefits are, and have worked so hard to bring these benefits to as many folks as we can and to increase access to care and services. We're going to change to a more hopeful side of things right now, because I think as we talk about what's at stake, it's important for us to remember what has been created, why it's been created, and why we need to push so hard to maintain these things. So I was talking previously about the great successes that have been happening across the country over the past few years at states making improvements and expansions to their benefits. And the numbers paint a great picture, but we always knew there was bigger stories, behind the numbers. So last year, as we were going through the new round of surveying and data collection, our work group decided it was important for us to understand these stories more deeply. And so, and understand how these changes came about, what conditions were like on the ground, really like what was the secret sauce, as my colleague Stacy Chazen says, that helped bring about some of these really enormous changes that have happened. And so Stacy Chazen, who I just mentioned, has been working over the past year to do rounds of interviews with various stakeholders in 5 different states. And we are so very delighted to share the first of 2 case studies that we have created looking at stories of success across our country. And I am absolutely thrilled and delighted that our very first case study coming out today, just hot off the presses today, is about Utah. And I'm even more thrilled to be introducing our panel today. We have 2 wonderful speakers with us, if it'll let me advance. We have Dr. Jennifer Strohecker, who is the Medicaid Director with the Utah Department of Health and Human Services, and Dr. James Becker with the University of Utah School of Dentistry. They are going to talk about how they made things happen in Utah and how they have gone and created this really exceptional program that is bringing care to so many across their state. I'm not going to take any more of their thunder. I'm going to turn it right over to them. And thank you both so much for joining us today.
Thank you, Stacy, and thank you to the CareQuest team for the opportunity to present our work today. We're excited to walk through a few slides that outline our story as it has occurred over the last several years that's really been able to build out our adult dental benefit through our partnership with the University of Utah School of Dentistry. So I'm going to start with just some background slides. I know that those of you who've logged in today are quite familiar with the role of Medicaid overall, at least in the healthcare continuum. And just a few facts to start out, that Medicaid really is the single largest insurer in every state. And not only that, we recognize, and of course it's, goes along with the statements around some of the Medicaid cuts that occurred through the One Big Beautiful Bill, the impact that these cuts may have because Medicaid is such a critical engine on state economies. Not only that, we know that Medicaid does represent a large share of spending that occurs in healthcare. So we don't just have the individuals who receive the benefits, but we also have all those providers that are foundational to delivering care. And really the money that runs through Medicaid certainly is essential to the larger infrastructure of healthcare delivery. Wanted to dive quickly into the state of Utah and how we see Medicaid fitting in here. So Utah's a little unique in the sense that Utah's Medicaid enrollment is the lowest of all states. So when we look at that, we'll just start by saying that Utah we have a lower number of Medicaid enrollees, but we're still looking at 350,000 Utahns who do receive their health care coverage through Medicaid every single month. These numbers are a little bit older, but 5.3 billion. It's gone up a little bit more for state fiscal year 25. So it's almost a $6 billion program in our state. And we run our whole program with under 340 employees that make the engine go round every single day. Years ago, when we really kicked off our work, in my tenure as the state Medicaid director, we really aimed to focus on 4 main priorities. And we've been very focused on this as we think about our policy development and how we want to serve the individuals through the resources we have in our program. We've really oriented our work around this. And I think as we profile specifically the work we've been able to do around dental care in our state, and more specifically the work that we've done through the School of Dentistry partnership, I think it's really important that you think about how our strategic priorities have really been able to be realized through our partnership with the School of Dentistry. So first, really finding the member and really elevating the member voice in our work. And that's been really critical as we think about our team that's developing policy and thinking about what funding we get, really putting the member in that lens as we do that, making sure that access to services and how they experience those services is reflected through that member voice. integration of care. Medicaid can be very siloed for people to experience it: physical health, behavioral health, oral health care. And we really wanted to think about whole person care as we approached our work over the last number of years, and really trying to get upstream. The cost of healthcare is only going up. We know that. The quality of care. We wanted to focus both on how we can get upstream and focus on preventive care, and then also address quality of care in that. And I'll just say, we're not going to spend as much time focusing on this. We could certainly go a lot deeper in this as we go through our dental slides, but through the work that we've partnered with the University of Utah School of Dentistry, we've really been able to prioritize and realize all these sort of strategic goals through this partnership. We've already touched on this earlier, but recognizing that dental care is a required component for some individuals that are served through the Medicaid program, and then it's an optional service in other groups. So on the left-hand side here, as you look at the left side of this and your screen, you'll see that we run our children and pregnant women benefit through a managed care delivery system. These are mandated groups with a defined comprehensive coverage policy. For Utah Medicaid, we've been able to really build out our adult services through our partnership with the University of Utah School of Dentistry by running this through a fee-for-service model. And I'll go a little bit deeper into that in our next slide. While we are able to be flexible in our coverage policy, our goal here was to really be holistic in the types of services that we were able to develop and fund for adult dental benefit. And you'll see that there is really a comprehensive coverage policy for our adult dental services today through the relationship and the funding mechanism we have in that relationship through the School of Dentistry. It was a number of years ago that we were able to stand up this service, but it really began with this infrastructure of having this relationship hosted through the fee-for-service delivery system. And I think that was a critical piece as we looked at how we were going to fund this. The University of Utah came along, and we'll go through our pathway of how that relationship has evolved over time. But to really understand how this works, this is a fee-for-service program. So the program that I oversee here with our state staff really has the policy components, and our dental policy is developed here with our Medicaid policy team. The team also has prior authorization staff. So we have nurses and also non-clinical staff that review all of the prior authorization requests that come through on behalf of the adult dental enrollees. And then we also have our claims processing here in-house at the Medicaid program. So the sort of engine of the program is hosted here at the Medicaid program. And the University of Utah School of Dentistry has other responsibilities, and through that relationship you see here the bullets around growing the provider network and providing those provider support. So they're really the feet in the community where they have really their training, and they're very much part of training dental students and dental residents and running clinics in town, but also that relational aspect that we've been able to build through the School of Dentistry, but also the relationship with the Utah Dental Association as well, and other community partners. And Dr. Becker will touch on this just a little bit more, but I think it's important just first of all what that foundation looks like through this program is that it's rooted in a fee-for-service program, and then the relationship is that we work very, very closely with a contractual relationship with our School of Dentistry. So we have a contract with them that kind of outlines what this provider relationship will look like, and then we work in combination with one another to really deliver services so that they feel seamless to both our providers as well as to the members. Is there anything else you want to add there, Dr. Becker?
I think you've described it well, Dr. Strohecker. Thank you. It does bring up some questions about the nuts and bolts of how we made it happen, and we'll talk about that in a minute.
That's great. Okay, so I'll keep running through a little bit more of the background, but an opportunity we had that actually more recently came up, and we had some beginning work early on that kind of laid the foundation of relationship, and it's been a pleasure over the last number of years to really see this program go from its infancy to a really effectively run operation that's running really best in class, and we're very, very proud of both the operational components, the policy components, but also the degree to which members and individuals, patients, are able to really access care and get a full scope of services. More recently, as we've been kind of putting these building blocks together, in our 2023 legislative session, there was the ability to really advance dental services and expand it to all adult expansion members. And that's something we just went online with just this past year in April of 2025. So even throughout this past many years where we've had continuous enrollment and those ongoing requirements through the pandemic and then Medicaid unwinding, we've been able to actually put and advance different policies in place to be able to continue to advance our work even in the context of enormous program change. And with that, we were able to go online with 70,000 new adult enrollees this past year.
And I think, Dr. Strohecker, one thing that is a little teaser that we'll throw out there is because of the relationship with the School of Dentistry and how that's structured, there was not a fiscal note to the state. There was not a cost to the state to do that expansion.
Yeah, and I think that's a really good point you bring up, because as we think about just even the structural design of this, how did this happen in the first place? And I think one of the opportunities, and maybe I'll just go ahead, this slide just touches on how comprehensive this service is for adult expansion members. But I think it's important to understand the journey, because, I think it really starts in about 2008, 2009, when, state programs were really experiencing sort of this financial crisis that was happening nationally. And we were all looking, our state budgets were constricted, and we were asked to have budget cuts and looking at different optional programs and services, and all states were exploring, what do we do with this financial situation that we're in right now? And at that point in time, Utah had to eliminate adult dental benefits. Now, this preceded adult expansion, of course, but we did have adult groups at that time that were optional groups that were receiving adult dental benefits, and there was a general fund contribution at that point that was paying for and supporting these. So I think the one piece that I think is important is there had always been an investment in our state to believe in oral health care and the value of oral health care for Medicaid enrollees. So you see, up to 2008, 2009, when the budget cut happened, there was an investment in dental services, not just for our mandated populations, but for our optional populations as well. And then it was here in 2013, 2014, 2015, and 2016 that really this relationship started building with the School of Dentistry, and an opportunity and a partnership came in. And maybe Dr. Becker, I'll let you speak here on the earlier conversations that occurred, where we identified not just a program partnership, but a financial partnership that developed. And so go ahead, Dr. Becker, if you want to just share some of that early relationship.
Yeah, as the University of Utah School of Dentistry came to be, we are a state-owned school, and in essence, we're a state entity. And at that time, we found a pathway to access funding for dental benefits in the state of Utah. It required two things. One was that the state portion of the seed money to access the program needed to be paid by a state entity, and the care needed to be given by a state entity. And because of the situation of the School of Dentistry, we qualified in both of those requirements. And so we stepped in, formed the relationship with the Department of Health and Human Services, the state Medicaid office, and qualified to access that funding.
It's wonderful. And thank you for that. So I think that was really the origin and how we've made sort of this growth over the years happen. And I'll say it started small. You know, we had a small group of adult beneficiaries called Targeted Adult Medicaid that I believe were our first foray. Is that right? Or individuals with disabilities, I guess, is where
Yeah,
we began this work.
we started out with the blind and disabled population. It was kind of a test. It worked well. We expanded to the Targeted Adult Medicaid, which was substance abuse disorder patients that were in treatment programs. That worked well. We kept adding these groups. Then we added elderly, 65 and older. And so those three groups, we just grew those that were receiving dental benefits. And under this model, it worked so well, and it was the perfect segue into Senate Bill 19, which allowed us then to expand to all adults in last year. Well, this year.
Thank you for that. So I would say it's been a journey, and I would also say that we've learned a lot through that journey. We've certainly continued to mature our relationship with one another and really help support our providers in the community to help them develop a new relationship with the Medicaid program. And we'll get into some slides on that in a moment. The other thing I would say, just starting small, but having uniform requirements, I think was really important. And then reporting out those outcomes to our lawmakers so that we could really be diligent in understanding what was working, how people were experiencing care. And then, so there were regular reports out to our lawmakers and to our legislative committees so that they were able to kind of get updates on how this program was working and really delivering really high quality care for people. And it was a very positive experience all along. So while we kind of grew the program over time, you could see we could add in more populations over time. And so I think there's a lot of questions that we'll address in the Q&A time, but I think it's important for us to spend a little bit of time talking about the relationships with community dental providers, because I think one of the common questions I got as an individual within the Medicaid agency and working as the Medicaid director was, oh, is this another managed care program? Do I need to start working for the University of Utah? And we had to really work through how that relationship was developed. And I think it's important to understand how we could meet the components of by qualifying to be part of that state entity and get that relationship, the financial relationship established, but also allow people to practice in rural communities and how to really bring on specialty providers and things like that. So I'll pass it over to Dr. Becker to talk about sort of the relationship building and really how that's also helped enrich our policy development as well.
Thank you, Dr. Strohecker. So this slide of the puzzle pieces connecting together is exactly what happened. As I said, the requirement was that the care be provided by a state entity. And there was no way that the University of Utah School of Dentistry could do all of the dental care around the state that was needed. So we partnered with the Utah Dental Association. We went to our legal team and we developed what is called an associated provider opportunity. And that is where any dentist in the state of Utah can sign a contract with the University of Utah School of Dentistry and in essence become associated with the school and thereby qualify as a state entity in their own office, in their own community, throughout the state, rural, urban, wherever they are. And that qualified them then to provide Medicaid dental coverage right where they were. That's the secret sauce, I think, that made this possible, because this associated provider model had the outreach to get to the number of providers that we need. We now have about 400 dental providers in private practices throughout the state that are associated with the University of Utah School of Dentistry. And it isn't a University of Utah School of Dentistry program. We're just the facilitators. It's the state Medicaid program run by the state Medicaid office and Dr. Strohecker and her team. But we facilitate because it's the University of Utah School of Dentistry that accesses the funding because we are a state entity. The state portion of the seed money that is paid into the program is departmental state hospital money in an interdepartmental transfer that helps seed that program and have it happen. So it's the School of Dentistry that facilitates it, but it is run through the state Medicaid office, and it is providers all over the state that provide the care. There are a number of slides here, and as we're going long on time, I'll just go through them, and then you can ask questions as you would like. Medicaid had a little bit of a bad rap, as many places know, and we needed to overcome that when we first started. We needed to let providers know that this was a different Medicaid approach, and this fee-for-service allowed us to have increased reimbursements. And so the reimbursements were competitive with insurance programs and other things that they were using in their office. The submission of claims and the payment back from Medicaid was quick. There was no co-payment by the patients themselves, and there was not a limit on the amount of work that could be done on the individual patients. So those are all things that were very, very welcome for the providers. The legislative buy-in was extremely important, and our legislators have been wonderful as they have supported this. They have noted that with the advent of the school, we're able to access the funding, and it doesn't cost the state of Utah taxpayers money. It's facilitated through the school and then run through the state Medicaid office. So that's been a real positive. The legislators love working with us. The community has been wonderful. The dentists throughout the state, as it first started, we would have to go out and really pitch this program to the providers and say, this is a different Medicaid. This is a better Medicaid. And now we don't have to do that. The providers in all the communities are standing up and telling their peers, this is really good. And we would rather work with the state Medicaid program than a lot of the insurance companies that we work with in our offices. So we go out through the Utah Dental Association to the regional district meetings and present and answer questions. We also have a team available that works with the Medicaid office to facilitate when there are issues that somebody has on a claim or a prior authorization. We get in and help facilitate that. The things that we're focusing on now is continuing to educate the members of the dental community and the providers, recruiting dentists, making it a positive experience for them. This allows us to do research because we have all the Medicaid information on the patients that are being seen. That is an absolutely wonderful symbiotic relationship with the School of Dentistry and our research department, because we're able to look at and do research based on what we're seeing and the care that's being given, so we can show. The goal is, and what has often happened, for instance, with substance abuse disorder, we were able to show that when you provide oral health care to substance abuse disorder patients, they finish their treatment programs. They don't go back to drugs as much. They become employed, and their housing situations are improved. And so we're able to show that through tracking the effect of what's going on here. These are just the hallmarks of what has helped it go forward and be positive. With that, we'll go to Dr. Strohecker and what you would add.
Just a couple other things. Thank you for all the content, because I think this is the testament. And I think that there had been some challenges with community dentists not having had a prior positive relationship with Medicaid in some ways. And that trust component, as we started smaller, it was evident over time that we were able to handle the bigger capacity because the trust was growing and there were more providers coming on board. And I think just one piece I'd love to close with is the fact that we started our new program for our adult expansion population in April. And by the time we reported out in August, I believe, 25% of that population had been seen for a dental visit at that point. And is that correct, Dr. Becker? I want to make sure. 25% had been seen for a dental visit already. And many of them had received just preventive care, while a portion had been able to get higher levels of care where they needed. So we are like the access to care component by having providers that were ready to see people then. They didn't have long wait times. The providers who may have already been writing off this service in the past and just like covering the cost themselves, they were able to bill Medicaid. And we were able to provide care to people who really had been waiting a very, very long time for it. And so I'll just say from my perspective, I couldn't be more thrilled that we've had such a positive relationship with the School of Dentistry. Their mission is very aligned with ours to take care of individuals, who really have complex healthcare needs and sometimes have very complex lives in addition to that, and really being an ambassador to carry that forward in the type of care, and then to train students and residents and really make it accessible. I think that's the other gem that's making it sustainable for us going forward, is that as you're able to like bring in your School of Dentistry and really have the students and residents working every single day with the Medicaid type population, it's really teaching them to really commit to public health and really provide care to a whole array of patients that they may see in their future. So just a couple things I wanted to just loop back on the person perspective. And there are dozens of examples of people who are just so grateful to have this available to us. So I'll stop with that, but I had to stop
and I
at
would
least just do a shout out, because it's been beautiful, right? To really be able to witness and be part of a service that people just really long for and have really needed in our community, but haven't been able to access before.
Yeah, and I would just add to that, from the administration point of view at the school, the University of Utah School of Dentistry we're inundated with patients because of this. We have no problem with patients, and our graduates are known across the country to be probably the best clinically trained students because of the amount of opportunity that they have to see patients. Dr. Strohecker mentioned the expansion happening April 1st of this year. The amount of care that was provided across the state with that expansion didn't just double, it more than doubled in the amount of care that was given. It's just mushrooming, and more and more people are being able to access oral care. So it's a very good thing. We could talk all day. We get excited about it.
Thank you so much, both. It was so wonderful to hear from you, and we have lots of questions for you in the chat. So from Brian, we have a question. What percentage of dentists in Utah accept Medicaid, and what kind of provider network exists in rural parts of the state?
So we have about a quarter of the dentists in Utah right now that are associated providers and that are taking Medicaid. That's just in the fee-for-service part. Then you have all of the pediatric dentists that are working currently with managed care. So I would say probably altogether it's about a third of the dentists in the state that are currently taking Medicaid. Our goal is to increase that, get it up to at least half of the dentists.
Thank you. And the second part of that is, what kind of provider network exists in rural parts of the state?
So that's a great question. And we are in all counties in the state of Utah, and many of those counties are considered rural. There were 3 or 4 that didn't have providers, and just this last 2 months we've added 4 new counties in the rural provider profile. So anybody in the state anywhere can go to the state Medicaid website, click on a link, and they can pull up Medicaid providers by zip code in the state and find out who they can see right in their own area.
Yeah. Can you share the substance use disorder care as tied to treatment completion report data?
Yes, that is called the FLOSS study, and it is published and easily accessible.
Dr. Becker, I'll jump in here too. We actually linked to the FLOSS study in the case study about Utah. So I'm going to give a plug again to our new case study out today regarding Utah's efforts to expand their benefit. And Jennifer, if you kind of, it's on the second or third page, you'll find a link right to the FLOSS study.
Of course, you're on top of that, Stacy. Thank you.
I have a question here. Can you remind us why the initiative had to specify that only state-associated providers could be reimbursed?
In order to access the funding, which came from a federal, came federally, the requirement from the federal funding profile was that it had to be provided by a state entity.
That's how the relationship between the intergovernmental transfers and the School of Dentistry providing the state seed, that whole relationship can only occur through state entities. And so that's how the community providers were then seen as associated providers. And I think there's a question too on what that provider agreement might look like. Is that something that's publicly available, Dr. Becker?
That is, in fact, you can go on the Utah State Medicaid website. There is a link to becoming an associated provider. You click on that. When we first went down this road, we were told that any associated provider would have to become faculty at the University of Utah School of Dentistry. And that was horrendous. It was terribly complicated and prohibitive. Nobody was willing to go through all of that. And so we went back to the attorneys and we said, let's look at this. And we went to the legal team and they looked at what the requirement was and what it would entail. And that's where they came up with the associated provider agreement. Much simpler, much easier for the providers. So it's right there on the Medicaid website.
Thank you. Do you have the capacity to provide care to people with intellectual and developmental disabilities through this program?
Yes. So the blind and disabled initially was one of those small groups. And so everyone who had disabilities was connected right from the beginning. And that has not gone away. It's just part of now all adults. And we have, through the University of Utah School of Dentistry, we are present in the neurobehavioral home in Salt Lake and see special needs patients there. We, through our general practice residency program, we have residents that take special needs patients to the OR and address dental needs there. And so we're working on expanding that as we get our residency expanded so that we have more and more opportunities for the special needs patients around the state. We have that ability now. We're working on expanding it because the need is great.
Have you seen an increase in preventive care by allowing your dental hygienist to operate in FQHCs or federally qualified health centers?
Yes.
Yeah, we have. I think there's been efforts to expand the dental hygienist scope of practice. However, from a perspective of being able to see what the hygienists are actually doing from a billing perspective, it's hard because we haven't seen a lot of independent dental hygienists actually bill Medicaid. Many of them are still billing through their dentist. And so we have not been able to see a huge uptake of that. So I would say like from a practice perspective, Dr. Becker is saying, yes, we have been able to do more of that. And certainly we've done sort of more expanded scope, and I know as a state, our lawmakers have put more opportunities for dental hygienists to practice independently and things like that. But we as a program are not seeing a huge jump up because we think while they're practicing, they may still be practicing and billing through the dentist that they're working with.
And in the state of Utah, we do not have independent practice for dental hygienists. They still work under the license of the dentists. And we're finding, for the most part, the Utah Dental Association has created an associate position with dental hygienists to be a part of the Utah Dental Association. For the most part, the hygienists want to keep that structure. There is a group that wants more independent practice across the country, and we're not doing that in Utah right now.
Is there any chance you can share what type of document the school signs with providers?
Absolutely. As I said, anyone can go on the Utah State Medicaid website, and there is a link. You can pull up that associated provider document.
Awesome. This last question is for you, Stacy. What led to so many states expanding dental benefit coverage for adults between 2020 and 2024?
Sure. Well, I want to open it up because I'm not going to hit on all of them, I'm sure. And Dr. Strohacker and Dr. Becker, please jump in from your perspectives, from what you're seeing as well. But, I think so much of what happened in the last 4 years is related to a few things. One, just our growing awareness across the country of how important oral health is and how connected it is to overall health. And that is because of everyone on this call making that case. I think the other thing too, is really that states are realizing how beneficial the benefits are. For states that had cut benefits, they're realizing it didn't necessarily bring a lot of cost savings because they saw spikes in or increases in emergency room visits, or they saw, different health conditions maybe getting worse. And as Dr. Becker mentioned with the floss study and some of the other outcomes data that they're showing, having a benefit, having access to care actually makes things better for folks. And I think the other thing too is we've had a general expansion with Medicaid, not just dental benefits, but Medicaid expansion over there has helped elevate all of these things to meeting the needs of, of patients and communities. And please, anyone else jump in because there's a lot of factors.
And Stacy, I would endorse what you just said, and I reference a question in the chat that talks about looking at ED visits, emergency department visits. So you're exactly right. As we improve oral health, general health improves. And one of the things we're doing in all of our clinics with the University of Utah School of Dentistry is combining with medical providers and integrating oral health into primary health. We have 3 or 4 clinics they're right there together. And we're doing those studies that show the improving general health. And then we have a study going on right now in the state where we are training emergency department personnel in how to triage dental emergencies better and then get them out to the associated providers in that community. And we're looking at the decrease in oral health emergency costs to the state because of more knowledge of emergency department personnel. And we're going to show that as we provide this care in the community better, emergency room visits will decrease. And that, as we all know, is the most expensive way and not an end-all solution to your dental problem. It's just a Band-Aid. So we are doing the research to show, and I think that's why dental care, everyone's on this, because we know it improves general health and it's going to decrease overall healthcare costs.
Thank you so much, Dr. Strohacker, Becker, and Stacy. It was so wonderful to have you all on. Please complete the evaluation for today's webinar. We so appreciate you all joining us today. Hope you have a wonderful rest of your Tuesday.
Thank you so much.
Thank you, everyone.